Some people are so afraid of going to the hospital during this pandemic, they're doing anything to avoid it. And that includes some pregnant women who are inching closer to their due date. Jacqueline Francis introduces us to one West Michigan woman who made a last-minute switch to a home birth.
Stay home, stay safe. It's a phrase pregnant women are taking to heart. For Jacqueline Shea, one of West Michigan's newest moms, it came down to a last-minute decision.
My husband and I, our birth plan was originally to give birth in the hospital. That's what we did with our first son. And we had a really great experience. But, you know, with everything going on, we got kind of concerned just with how safe is it going to be in the hospital if that's where all the sick people are.
The couple took their concerns to Jennifer Holshoe with West Michigan Midwifery. And as it turns out, they weren't the only ones.
As women are concerned and families are worried about going to the hospital and possible exposure, another anxiety for families at the moment is the concern that they won't be able to have the support people with them at the hospital when they get there.
A new reality expecting mothers are facing as hospitals nationwide limit the number of people allowed in the delivery room and visitors in general. Jacqueline delivered a healthy baby boy in the comfort of her own home.
With everything that's going on, it just seemed like a no-brainer for us.
As more expecting mothers come to that same conclusion, midwives are scrambling to meet the increased demand, while families struggle to cover the cost, as most insurance plans, including Medicaid, don't cover out-of-hospital births.
We are hoping that insurance companies will start to cover this more for families.
Last week, Friends of Michigan Midwives sent Governor Whitmer this letter asking she issue an executive order that would extend Medicaid coverage to licensed midwives as it aligns with the public health goal of preventing the spread of COVID-19.
A new Australian study shows children who are born prematurely are more likely to struggle in school. Researchers looked at standardized test scores of more than 7,000 students between 5 and 18 years old. They found children who were born early scored lower in reading and math than their full-term peers.